Hey guys, it's Hina Sheth here at Rebalance Physical Therapy in Narberth, Pennsylvania, as well as Center City, Philadelphia. And I am a physical therapist that treats in a holistic manner any dysfunctions that involve the spine, the hip, and the pelvis is actually what my specialties are. As well as the pelvic floor. So today I want to talk to any of you moms that are experiencing any sort of weakness, pain, or issue with walking after having a vaginal delivery and or a C-section delivery. And so what we've recently had is we've had a few patients that have been coming in that are experiencing difficulty with walking, standing, and even functioning after they have had a delivery. And so I'm here to kind of explain to you what might have happened and why some are more vulnerable than others as far as these injuries, and then what to do about it. So obviously, when you are having a vaginal delivery, you know, the baby is coming out of the vaginal area. And in this area, some of you may not realize that there is a whole group of muscles called your pelvic floor that the baby actually has to pass out of. And within that pelvic floor, there are nerves. And nerves is what gives sensation as well as function, meaning contraction and relaxation to these muscles. Now, there's also lots of muscles in and around the thighs, which for many of you, when you are delivering vaginally, your legs have to be put into what's called a lithotomy position, meaning they have to flex the legs, rotate them outward, and then spread them out wide. So for some of you, you know, when the baby is coming out of this area, okay, you can see here that this pink area, especially right in through here, these are all muscles that the baby has to stretch and pass through in order to get out of the vaginal canal. But within that area, there's a bunch of nerves that also have to stretch and allow the baby to come out. So you can see just from a vaginal delivery how some of these nerves can get traumatized and stretched and therefore can create any type of weakness in and around the pelvic floor, but they can also cause pain in and around this perineal area. Now, I also said there are nerves around the hip. So when you are put in that lithotomy position, sometimes, especially for those of you who have to have an epidural, you can't feel where your legs are. So if you are in a position where you can't feel your legs, but you may not have the full range in your hip, or you might have tight muscles that have to stretch outside of your normal range, you can get trauma to any of the nerves that pass through the hip musculature. Now, this is just a picture of the muscles that go partially through the front of the hip, okay? So you can see that, again, all this pink and red area, these are muscles of the front of the hip. And then all this yellow that comes out of the spine and goes down and in through the musculature of this hip, they're kind of like, you know, imagine strings going through and that are intertwined through that musculature. Well, when you're moving your hip around, those strings have to move as well. But those strings, which are nerves, don't have the elasticity that muscles do. So maybe your muscles can stretch, but since those nerves go through that musculature, they might not have the full capacity to stretch, and they can get damaged. Not irreparable damage, but they can get damaged, and they need sometimes specific therapy to help them heal and allow appropriate repair. So this is why if you're having difficulty walking or feeling like you have significant weakness or even pain in that area, what could have potentially happened. Now, why is some people more vulnerable than other people? Again, that has to fall within, do you have the right amount of hip range of motion? Do you have tightness in any of this musculature? So a lot of that just is very dependent on whether you have those things going on from your past, whether it's postural issues, whether it's trauma through like sports injuries or falls or postural issues that have created some tightness in that area that make you more susceptible and vulnerable to another mom that is delivered. Now, the other thing you have to also consider is that for those of you who have had C-sections, you know, they're going through this area and they're also cutting through the abdomen. And let me see if I can find a good photo here of the abdominal musculature. But basically, okay, can't find a great picture of the abdominal musculature, but basically, if you have to cut in and around through here for a C-section, there's lots of nerves that come through the spine that actually come down and into this area. And part of that nerve, okay, part of those nerves are these guys right in through here. These guys cross over, they go in and through the abdomen, and they come down into the inner thigh. And they also, some of them come down into this perineal area. So again, if you have had a C-section, again, some of those nerves potentially could get damaged. And so this is where you might be experiencing some of the symptoms that you're having. So what's to be done about it? So if you are experiencing any of these things, what you really do want to find is you want to find a pelvic floor physical therapist that has a really good understanding of both orthopedics as well as pelvic floor therapy, that understands how to treat the two in conjunction with each other. Because when you talk about the pelvic floor is connected to the hip, it's connected to the low back, it's connected to the tailbone, it's connected to another bone called the sacrum. And so a good pelvic floor physical therapist that really does know how to treat all of these in an integrated fashion is someone that you can go to that can evaluate your strength, evaluate how much nerve damage that you've had, and do you need to be referred out to a specialist physician that you need further testing. But oftentimes what we find is that sometimes it's just trauma to these nerves that is eventually can repair, but with the right type of treatment from a physical therapist that knows how to work on these muscles, that understands how to work on alignment, and knows the specific strengthening and stretching that you might need to do, can really work on this to start accelerating the repair process and helping you progress your healing at a rate that's even faster than how it may normally heal. And so if you can find someone like that in your area, that is who you want to see. Usually you're seeing physical therapists that treat in this capacity about once a week, and you'll usually start to see progress somewhere between like a month and a half to 2 months. You should start seeing some progress, and perhaps even before that. Now just remember, nerves sometimes can take a while, even though nerves can take a while to repair. So sometimes, even though we're balancing out the alignment and we're working on the muscles and we're starting to get better blood flow to these nerves to start the repair process, sometimes there can be a delay because nerves just take a little bit longer to heal than the muscles, etc. So if you live in and around the Philadelphia area or any of the surrounding suburbs, it's a no-brainer. Come see us. This is what we deal with and specialize on an everyday basis. Our website is rebalancept.com. That's REBALANCEPT.com. You can come to our website. We have lots of helpful information and tips. We have other additional YouTube videos that you can look through. Sometimes we provide helpful tips that you can start to do. But if you're finding that you're kind of stuck and you need another opinion, give us a call, and you might even qualify for a free consultation if you live close to us and are looking to come in for treatment. If you do not live near us, then you can come onto our website, and I encourage you to use the contact form where you can ask us to help you find someone that's in your area. Usually, any of the big metropolitan areas, we usually have specific names to pelvic floor physical therapists that are really good. And if you live in an area where it's a little bit remote, then we can kind of direct you to certain sites that can help you find someone that might be able to help you. So I hope this information was helpful to some of you moms. And again, I'm sorry if you're experiencing this, but hopefully you find this YouTube video and at least shed some light on what you can do on your way to healing, okay? Have a wonderful day, and I will talk to you soon.